Hi, it's Dr. Levi from Wiser's Road Chiropractic. If you've been suffering with pregnancy-related back pain, then you'll want to watch this short video where I'm going to talk about everything you need to know about getting rid of your pregnancy-related back pain. I'm going to cover the 5 types of back pain you can experience during pregnancy, 3 reasons why we get back pain, and 3 simple exercises that you can start doing to help your back pain. So, watch the video. "50 to 80%. That's the estimated number of women who experience lumbopelvic, lower back and/or pelvic pain during pregnancy. Being understandably cautious of what medications to take and treatments available when pregnant can leave you with limited options, and often women find themselves unnecessarily putting up with the pain, making what should be a joyous, treasured and celebratory 9 months into a difficult, frustrating and agonising nightmare where the physical limitations of being pregnant are compounded with pain. Firstly, do we have a design flaw? It's hard to improve on perfect, and the design and function of the human body is about as perfect as it gets. A perfectionism that you would expect to continue as the body goes through pregnancy. And it certainly does for some females, but others are not so lucky. Some women coast through pregnancy without being the least bit affected, while others are burdened by mild aches and pains, and still others suffer severe, near debilitating lower back and/or pelvic pain. The specific cause still remains a mystery. However, evidence is now beginning to reveal some answers. The often blamed hormone relaxin may not be the only culprit. And the good news is there are some safe and effective natural options for pregnancy-related lower back and pelvic pain. Why are some women affected by pregnancy-related back pain and not others? Before we dive in and shed some light on this question and then provide some solutions, let's orientate ourselves so we know exactly what we're talking about when referring to the pain felt during pregnancy. Lumbar pain is typically midline pain along the spine and the muscles closely surrounding the spine of the lower back. Pelvic girdle pain affects both sacroiliac joints, the pelvis joints at the back, and the pubic symphysis, the pelvic joint at the front. Pain felt in any of the previously mentioned areas can radiate or travel to the back or front of the thighs, and in some cases, down the leg. When it is hard to differentiate between lumbar or pelvic girdle pain, it is often referred to as lumbopelvic pain. And it's not uncommon for pregnant women to have elements of both. A typical scenario can involve pelvic girdle pain during pregnancy, which then shifts to lumbar pain post-pregnancy. Chiropractic care leading up to conception, during pregnancy, and after birth can provide a safe and effective treatment option to minimize any pain during and after pregnancy. Here are the 5 patterns of pelvic girdle pain during pregnancy. On the left-hand side, we see symphysis pubis pain. This is pain located at the front of the pelvic joint. Number 2, both sacroiliac or SI joints will be painful. In the middle, number 3, unilateral SI pain, pain on one side of the pelvis. Number 4 demonstrates the full pelvic girdle syndrome, where we've got pain in all 3 of those regions, both SIs at the back, so both pelvic joints at the back and the pelvic joint at the front. Number 5 is our constant variation pattern, where we have pain between all 3 of those regions constantly varying. Despite what pattern of pain you are experiencing, there are safe and effective things you can do to relieve the pain, which we'll discuss soon. 3 factors that contribute to pain during pregnancy. 1. Ligamentous laxity. Ligaments are the connective tissues that hold bones together and help form joints. During pregnancy, there is a remodeling of the pelvic ligaments in order to accommodate the birthing process. The hormones relaxin and estrogen are largely responsible for this process. Relaxin levels rise between 10 and 12 weeks pregnancy and remain steady at this level until the late stages of pregnancy. In the following days after birth, the levels drop to become undetectable. Numerous studies have investigated the role of relaxin in pelvic girdle pain and could not find a relationship between serum levels and pain tendency. So, relaxin plays a role but is not the cause of pain. However, any pre-pregnancy lower back or pelvic dysfunction will certainly be amplified in the presence of relaxin. Number 2. Lumbar hyperlordosis. The spine has 3 natural weight-bearing curves that provide it with shock absorption. A forward curve, lordosis in the neck and lower back, and a reverse curve, kyphosis, through the mid-back. The weight gain and the location of the increased weight in pregnancy forces women into that classic pregnancy posture, with an increased curve in the lower back as a means to counterbalance. A 20% increase in weight can increase the loading on the lower back joints by 100%. This large increase in loading can lead to joint and muscle pain in the lower back region. Number 3. Soft tissue edema. Another reason that women experience pain during pregnancy is because it's estimated 80% of women will experience soft tissue edema, which is increased fluid retention in the last 8 weeks of pregnancy. This predisposes pregnant women to calf swelling and cramping, plus all sorts of nerve entrapments which can lead to numbness in areas such as the hands or outer thigh. What can you do about lower back pain in pregnancy? Chiropractic care. Chiropractic care is a safe, gentle and effective option for helping pregnant women with lower back or pelvic pain. By helping restore natural alignment of joints, the body is able to move normally, which can decrease pain and any associated muscle soreness. The right type of exercise. Low to moderate intensity exercise is a good option to promote and maintain proper movement. It is also essential to keeping the muscles of the lower back and pelvis active, which provide you with stability as you go through your pregnancy. It's very hard to beat the basic activity of walking. The movement associated with walking has many benefits for the lower back and pelvis. The important stabilization muscles of these areas get a good workout with the simple act of walking. Swimming is also a good activity. Plus, many women as they get heavier in pregnancy enjoy the anti-gravity effects of the water. Swimming, once again, allows you to get a safe range of movement through the lower back and pelvis and also works the stabilizing muscles of those areas. The pelvic tilt, a simple but really powerful exercise to get some proper movement in the pelvis and lower back. You can begin by lying on your back with your legs bent. We'll start with the top diagram. What we're doing here is gently tucking under the pelvis to flatten that normal natural curve in the lower back. So you're aiming to tuck under the pelvis so that lower back is flat and touching the ground. Then we alternate with the bottom picture, the movement in the bottom picture, rocking the pelvis forward to accentuate the arch in the lower back. We alternate between these two movements, flattening the back and accentuating the arch. This helps feed proper movement into the pelvis and lower back. You can repeat this 8 to 10 times throughout the day. In clinic, many of the pregnant women I see have problems with activating their glute or buttock muscles. I call it glute amnesia. It's like you've forgotten how to use your glutes. This is also a common finding in the non-pregnant population for males and females with back or pelvic pain. These muscles are essential for stability, and a weakness in them can lead to pelvic and or lower back pain. Correcting glute amnesia. A two-step approach to turning on these glute muscles is used. The first step with chiropractic is to restore proper alignment in the lower back and pelvis, which ensures that the nerves and muscles of those areas are ready to work properly. Now that the muscles are ready, we can begin to re-establish the brain-body connection with some simple activation exercises. We can use exercises like the glute squeeze, In a standing position, you can take your index finger and place it on the glute muscle, the buttock muscle in your hip pelvic area. In the standing position, I want you to imagine squeezing these glute muscles as hard as you can. You're using your finger for feedback. What you should feel is that the area below your finger, the muscle below your finger, should firm up and tighten. I want you to squeeze and concentrate on holding this squeeze for 10 seconds. You can rest 10 seconds and you can repeat that up to 10 times. You can do this simple exercise throughout the day repeatedly. Thanks for watching. If you enjoyed that video, here's what I want you to do next. Share it on your timeline. You may never know if you have friends or family that are pregnant and suffering with back pain or pelvic pain, and this video could really help them out. If you've got any questions about chiropractic or any of the stuff we talked about in this video, leave them in the comments below and I'll answer them. Thanks again for watching, and I'll speak to you soon.